Welcome back to Open Med School. In the last session, we had defined stroke and TIA. And TIA, even though the duration is 24 hours, usually lasts less than 15 minutes. And if it's more than 1 hour, likely that there will be some infarction of the brain. And neuroimaging should be there to confirm whether it is a TIA or stroke. Now let us start with a case. A 65-year-old man has come with right-sided weakness, and the relatives are telling he is talking in a funny way. It has started 2 hours back. How will we approach the case? As per definition, a neurological deficit of vascular origin which is focal is a stroke. So first and foremost is stroke. But should always think about the stroke mimics. A focal deficit can occur in abscess, subdural and epidural hematoma, tumors, aneurysms, vascular malformations, in hypertensive encephalopathy, encephalitis, seizures, and especially seizures leading on to towards paralysis. Always remember migraine. Even the metabolic conditions produces global hypoglycemia, and hyperglycemia can lead on to focal abnormalities. Cerebral venous thrombosis, even though it is considered as comes under stroke, keep in mind cerebral venous thrombosis, psychogenic causes, and most important, a previously existing stroke made worse by a general medical condition. These are the differential diagnosis that you should keep in mind when a patient comes with a focal deficit. Now we know that there are a number of causes for focal deficits, but the stroke is characterized by one, the suddenness. Second, can be explainable on a vascular territory. So these are the 2 points and will distinguish stroke from other things. In the most of the differential diagnosis which we are considered for the stroke mimics, there are associated features. For example, somebody with encephalitis, there will be fever. Somebody with a brain tumor, usually unless they present with a vascular accident occurring into the tumor, that is a bleeding occurring in the tumor or developing a seizure, it will not be sudden, it will be gradual. In case of migraine, most often the typical history of migraine past history will be there, and the aura and other features will be there. So by looking into the associated features of each condition, we can differentiate. But still keep in mind, most important differential diagnosis is metabolic, that is hypoglycemia. Hypoglycemia can mimic a stroke, and that is why a random pressure is a must before the patient is sent for CT scan. It should be kept in mind. So in the next session, we'll be discussing how will you approach a patient when they come to the casualty with a suspected stroke. Hope this was useful to you. Stay tuned for further videos. Thank you.